slide of first two kidneys, which is right and left, and two ureter, one urinary bladder, and urethra. We're going to talk about the anatomy of each structure and also the difference, if there is a difference between the right and left, and also if there is different in the structure, like in the urethra, in the male and the female. So let's start about the kidney, which is right and left. The main function of it is to produce the urine. Then the ureter, which is also right and the left, that is connected to the corresponding right and left kidney, that is gonna transport the urine from the from the kidney to the urinary bladder. Then finally the urinary bladder, which is store the urine before the elimination, and finally the urethra, which is the last part of the urinary system to conduct the urine to outside of the body. So first, let's start with the kidney, and let's start specifically with the kidney position. And as you can see here, first it's the retroperitoneal organs that is gonna lies from the level of T12 vertebrae till L3 vertebrae. And as you can see here, it's might differ in the right from the left. This is the posterior view of the back of any person, and the kidney, it's a retroperitoneal. What is the meaning of the retroperitoneal? Retroperitoneal, that's mean it's gonna lie in the posterior part of the peritoneum. It's gonna lie behind the peritoneum, which is the covering of the GIT system. Also, the kidney is going to be in the posterior part of the body, which is the posterior part of the posterior part of the GIT system. Again, it's going to lies between the vertebrae number T12, thoracic 12 till number 3. The right and left, as you can see, it's going to be differ in their position. And the right kidney, as you can see here, is a little bit lower than the left kidney. Why? This is because of the liver position, or specifically the right lobe of liver, which is gonna push the right kidney lower than the left kidney. So if we are more specific, as you can see, this is the right kidney from the posterior view, and this is the left kidney from the posterior view. The right kidney from the posterior view is going to be related or opposite only to rib number 12, while the left is going to it's going to have a relation to the 11th and 12th ribs. Okay, so let's go to the next slide, which is about also the kidney anatomy. So now we finished the position of the kidney. Let's talk more about the kidney shape. It's a bean-like shape that it has two pool, upper pool and lower pool, two surfaces, anterior surfaces, which is this picture, and posterior surfaces, which is in here. As you can see, the ureter is the most posterior structure that is going to enter to the hilum. That's why we could differ the anterior from the posterior. We're going to elaborate that more. So also we have two border, which is the medial, which is going to include the hilum, and the lateral, which is the greater curvature of the kidney. Let's talk about the lateral border, which is convex, as you can see, while the medial border is concave, that is contain the hilum, that is going to receive the blood supply, the venous drainage, as well as the ureter. So if we order them from anterior to posterior, the first and the most anterior is going to be the vein, the renal vein, then the renal artery, and finally the ureter. So as we said, the hilum gonna contain renal vein, which is the most anterior. Renal artery is gonna be the intermediate, and the most posterior directed downward is gonna be, as you can see here, the renal pelvis. And also the hilum is going to contain some other structure like lymph vessels and sympathetic fibers. Okay, next slide is going to be about the external feature of the kidney. Let's first talk about some of the relation, especially around the surfaces. The anterior surface, we said it's a retroperitoneal structure. That's mean, as you can see, this layer, this all layer that is gonna surrounding the GIT structure is called peritoneum. The kidney, as you can see here in the posterior of the body, is going to be retroperitoneal. That's mean it's going to be behind the posterior surface of the peritoneum. This is going to be the anterior surface of the kidney is going to be related to the peritoneal, or is going to be retroperitoneal, and is going to be related to the abdominal organs, as you can see here in the anterior view to the two kidneys. Let's talk about the posterior surface. The posterior surface, as you can see, it doesn't have any relation with the peritoneum, so it's not covered with the peritoneum. It's more related, as you can see, with to the muscle of the back or the posterior abdominal wall, and some of the ribs depend if it's right and left, as we identified before. That is right only related to the 12 because of the liver pushing down the right, and the left is going to be related to the 11th and 12th rib. So the covering of the kidney. The kidney is going to have first this white part that you can see in here. It's called fibrous capsule that is cover the kidney. Then under this fibrous capsule, we're going to have something called perirenal fat, which is cover the capsule main supporting factor. Then we have the renal fascia. Sorry, the capsule is going to be attached to the kidney, then the perirenal fat, and then the fascia, which is this part, and finally, from the anterior part, we have the pararenal fat, which is gonna cover which is a fascia that covers the kidney from the anterior part, or the retroperitoneal part is gonna form the retroperitoneal fat that is under the retroperitoneal covering in the anterior surface. Again, we have the capsule that is attached directly to the kidney, then the perirenal fat, then we have the renal fascia that is going to cover or outside the perirenal fat, and finally here from the anterior only we have the pararenal fat, which is covers the fascia from the retroperitoneal fat, and its amount is it's variable depending on the opacity or the amount of the amount of the central fat in the around the GI system, or about around the abdominal structure. So we finished now the most important anatomical structure related to the kidney. Let's go a little bit deep to the histological or internal structure of the kidney. So if you can see, this is the kidney from, if we take any kind of cross-sectional, not cross-sectional, sorry, horizontal cutting. As you can see here, the outer pale layer is going to be what? Is going to be the cortex. Then we have a deep layer which is darker and it's look like a pyramid. It's called what? Medulla. So the outer pale colored, it's going to be under the capsule immediately. Then deep to it, as you can see here in the inner part, is going to be the medulla, which is deep to the cortex. So this is the cortex, and this is the pyramidal shape. As you can see here, they are the pyramid. Let's elaborate more about the pyramid. As you can see, the pyramid, um, which is the medulla, is going to divide it into many pyramids. Each pyramid, which is triangular in shape, each pyramid has a base that is exposed to the cortex, so related to the cortex, and it has an apex, which is directed to the hilum, which is the medial aspect of the kidney. Type. At the end of the apex, we're gonna have some small tubes that is gonna formed to collect the urine from the pyramids. Those tubes, it's gonna be called minor calyces. Those minor calyces, they're gonna be united together to make major calyces. And then this major calyces with this one and this one, all of them, they're gonna be forming the renal pelvis, which is the first part of the ureter. This is the dilated part of the ureter is going to be called what? Renal pelvis. After that, the ureter is going to be continued um, um, as the ureter proper. So again, if we read it from here, each pyramid has a base, as we said, that is directed to the cortex, and also has an apex, which is directed toward the hilum. Each apex is surrounded by minor calyces, as we said, also here. Then that collect urine and unite together. As you can see, the minor calyces unite together to form the major calyces, which is unite again the major calyces to make the renal pelvis. As we said, it's the expanded upper part of the ureter. Generally, what is the function of the kidney? I think you've took that in the physiology or you're gonna take it. So the main function of the kidney is gonna be to remove the metabolic waste that produced from the blood and secrete some of the hormones that are responsible for RBCs forming, which is erythropoietin. This is the hormone that is going to be responsible to make a new RBCs or participate for making, produce new RBCs, new red blood cells. Yes, as we said, it's going to secrete the hormone erythropoietin, which is going to stimulate the bone marrow to produce red blood cells. Finally, it's going to also secrete some other hormone like renin, which is going to help to regulate the blood pressure. And that's very important to understand because as you know, uh, um, this part, which is the renin, there is some kind of medication that is going to target this hormone to reduce the blood pressure in the body. So that's why it's very important to know this hormones that is going to be produced by the kidney on top of removing the metabolic waste from the blood. So if we are talking about the histological and microscopic function or anatomy of the kidney, it's going to be the nephrons. What is the nephrons? The nephrons is the functional unit of the kidney. That is, we could not see it by our eyes, but we could see it under the microscope. Each kidney is going to contain about 1 million nephrons. Each nephron is going to be made of what? Of Bowman capsule, as you can see here, here, and here. Then from the Bowman capsule, where the filtration gonna start of the blood, it's gonna go to the proximal convoluted tubules, and then it's gonna go to the loop of Henle, and finally distal convoluted tubules. That's all of them. They're gonna connect it together into what? Into the collection duct or collecting duct. Of course, you know each part of these nephrons from the Bowman capsule till the collecting duct is gonna have different specific physiological function. I will leave it for the physiology. It's not gonna be my part. So for me, the most important part is to know the names of those nephrons, the part of those nephrons, and the function we're gonna leave it for the physiology. Okay, so now we finished mostly the kidney, so we're gonna come to the last bit of the blood supply of the kidney and also the venous drainage of the kidney. So as you can see here in the posterior abdominal view, we're gonna see the abdominal aorta. One of the bird um, arteries that is gonna going out of the abdominal aorta, which is represented in red, is gonna be the renal artery. It's gonna be right renal artery, which is gonna go to the right kidney, and left renal artery, which is gonna go to the left kidney. Also, there is, because we have, of course, an artery that is gonna carry the oxygenated blood, we need a drainage of the outcome blood that is gonna carry CO2 and after the filtration. So it's gonna go out through what? It's gonna go out through the renal vein from the uh, right and from the left, and is going to be drained into the inferior vena cava, which is going to end up afterward into the heart. So it's going to be also another bird vein that is going to be drained into the inferior vena cava. So now we finished the kidney, the blood supply of the kidney, the surface anatomy of the kidney, the relation, the surfaces, the borders, the hilum, the content of the hilum. And we know that one of the content of the hilum, which is the most posterior, is going to be the ureter. And we've explained that the upper extended part of the ureter is going to be called what? Renal pelvis. And then after that is going to be continued as what? As ureter proper. So let's start the ureter. The ureter is a muscular tube. It's about 25 centimeter. Its upper part is gonna be expanded and extended, and is gonna called what? Renal pelvis. That is gonna collect. It's gonna be formed from the unity of the major calyces. And also the ureter proper is going to be starting where? At the lower end of the lower ball of the kidney. So from here, the ureter proper is going to starting to be formed. So at the beginning, it's going to be called what? Renal pelvis, and the lower end of the lower ball of the kidney is going to start to be called what? It's going to be called ureter proper. It's going to be descend in the abdomen till it reach what? In the both side, as you can see here. It's going to be along the vertebral column, and it's going to be crossing the bifurcation, which is in here, as you can see, the bifurcation of the common iliac artery, either right or left. So it's gonna cross what? The bifurcation of the common iliac artery, which is the landmark to know that the ureter is left the abdomen to enter what? The pelvis. So this is the most important thing around the ureter, but let's continue the other stuff that we need to know, and we need also to identify what is the significance of it. So as you can see here, the ureter has 4 sites of constrictions, and we already mentioned some of them. So of course, one of them is going to be at the side of bifurcation of the common iliac artery. Okay, this is not the first, this is gonna be the second, because the first one is gonna be at the beginning, which is gonna be the transformation from a renal pelvis to a ureter proper. So it's at the beginning of pelvico-ureteric junction, which is the transformation from being renal pelvis to ureter proper. The second part, as we said, at the site of bifurcation of common iliac artery. What about the third side? The third side is going to be at the level of ischial spine. And as you can see in this picture, it's going to be here. So this is the tip of ischial spine, and this is the ureter is going to lying on anterior to it. So this is the third constrictor side. Let's come to the last one, which is at the end. It's gonna be the last side of constriction, which is as when it's gonna enter the urinary bladder. So it's gonna be when the ureter enter the urinary bladder. This is gonna be the last and fourth side of constriction. Why we need to know this side of constriction? Because this side of constriction, as you can see, the transformation from being wide to small tube, muscular tube, is gonna be side of stone to be trapped in there, or stone impaction. Also, here the bifurcation of common iliac artery, it's going to cause a side of constriction, which is also another side of stone impaction. And finally, also at when it's entering the urinary bladder. As we said, it's a muscular structure. So if we have a stone, that means there is a contraction of the muscles of the ureter, which is going to cause a severe pain. That's why always with the renal stone, the patient going to feel a lot of pain. So this is all about the ureters. So we need to know the blood supply of the ureter. As you can, this is the ureter from the right, and this is the ureter from the left till the urinary bladder. So as you can see here, it's received some of the blood supply from the renal artery, and some of them from the right gonadal artery, or even left, and some of them also is gonna come from the abdominal aorta itself, and finally some of them is gonna come from the common iliac arteries. So this is the blood supply of the ureter. So now we finished the kidneys, we finished the ureters. Let's come to the urinary bladder. So what about the urinary bladder? First, let's clarify that the urinary bladder position at infant's stage is different than the adult stage. In infants, it's gonna be abdominal organ. Why? Due to the uh, the narrow pelvic cavity of the infants. While in adults, it's become what? Pelvo-abdominal organ by widening the pelvis. Let's talk about the capacity of the bladder. As you can see, if it's empty, it's going to be till this space. If it's full, it's going to be uprising till here. So in the adult, the maximum capacity is around 400 to 600 milliliter. Um, um, that's full of urine. It depends and vary between people and between male and female. So let's start about the shape of the urinary bladder. As you can see, it's a pyramidal shape. It's a pyramidal shape. This is from other view that it's gonna has a three-sided pyramid. It has two surfaces. One, it's superior, as you can see here, and the two inferior lateral. Inferior, but at the lateral side. So this is the superior. This is the inferior lateral, and we're gonna demonstrate that also in the practical session. Also, we're gonna have a apex, which is most anterior, and also base, which is the most posterior, which is here. From here, this is the base. So the apex is gonna be in the front. This is the base because this is the posterior view of the urinary bladder. Also, it's gonna have a neck, which is gonna be including the internal sphincter, and is gonna be continue as urethra. Also, so now superior, two inferior lateral, and one anterior, which is the apex, and the posterior is the base. This is the surfaces of the urinary bladder. Let's talk about the function of the urinary bladder. The function is going to be a reservoir of urine, as we said in the beginning of the lecture, and it's going to be a site in the pelvic cavity behind the symphysis pubis. As you can see here, the urinary bladder relation is going to be different in the male compared to the female. In the male, it's going to be posterior to the rectum. This is the urinary bladder that is behind the symphysis pubis in here. It's going to be posterior to the urinary bladder, the rectum directly. While in the female, as you can see here, is going to be in front of the uterus and the vagina. So is not related directly to the rectum. This is the urinary bladder, this is the vagina, and this is the uterus, and this is the rectum. So let's talk about the interior surface or the inside surface of the urinary bladder. So as you can see, the urinary bladder is pyramidal in shape, that it has some smooth triangular part which is called what? Trigone. And also there is some folding area, it's called what? Rugae. So it's a mucous membrane, as you can, all of this inside area, it's covered with a mucous membrane. If it's smooth, it's gonna called trigone. If it's forming or making folds, it's gonna called rugae. As you can see, there is a three opening, two for the ureters from the right and the left, and one which is representing the neck, which is for continuing as urethra. Between those three openings, we're gonna find the smooth part. This smooth part is gonna be called trigone, as we said. So the mucous membrane of the urinary bladder is thrown into folds, as you can see here, which is anterior and lateral and superior. This is gonna be rugae. And also, as you can see, between this opening and this opening of ureters, we're gonna find a ridge and a line. This is gonna be interureteric ridge. And then also the part of the mucous membrane which is lies between the three opening and it's a smooth, it's not kind of fold, is gonna be called what? Trigone. Also here, again, this is the two opening of ureters. This is the internal urethra, which is the beginning of the urethra, and this is the smooth part, which is the trigone. This is the fold, which is the rugae. As you can see, the trigone is a sensitive area that it's enriched with nerve supply, especially the parasympathetic, and we're gonna come to that in a little bit. It's gonna be in the posterior part of the urinary bladder, in the posterior part of the urinary bladder. So this is the interior surface. Let's talk about the wall of the urinary bladder. The wall of the urinary bladder is going to be formed of a muscular, of the muscle, of one muscles. This muscle is going to be called detrusor muscle. Okay, the muscle layers of the bladder is going to be called detrusor muscle. Is everything clear till now? Is there any question? Okay, excellent. Okay. So let's now start with the tricky part around the urinary bladder, which is what? Which is gonna be the nerve supply of the urinary bladder. As you can see here, we said that in the posterior surface, the smooth part is gonna be enriched of what? Of the parasympathetic or parasympathetic nerve supply. So, if the urinary bladder is full of urine, that's mean the urine is gonna compress on the internal sphincter and is gonna dilate and enlarge the urinary bladder. This is gonna send some parasympathetic and involuntary fibers to the spinal cord and then from the spinal cord to the brain. Then in the brain, we're gonna receive the input. The input is gonna come for a parasympathetic to give an order to the muscles around the muscle of the urinary bladder to contract and the internal sphincter to open. When this happens, it's going to give us a pressure over the external sphincter, which is the outer sphincter, that is going to be the second part of the urethra. This external sphincter is gonna send some somatic, which is voluntary, that we feel it. We feel it. That's meaning of somatic of voluntary. That's mean we could feel it. So it's gonna send some of the impulse to the spinal cord till the brain, and then it's gonna return back again to give an order for the external sphincter to open, which is a voluntary movement that we could control it um, when we go to the toilet when to come. So we have the smooth muscle in the wall of the urinary bladder and the internal urethral sphincter that is in the neck of the urinary bladder that is going to be controlled with what? With the parasympathetic fibers, which is involuntary. We cannot control it. While when it's open and the urine is going to compress the external sphincter, it's going to send the fibers and it's going to return to give us the urge or the feeling of going to the toilet, and this is going to be called voluntary and somatic, and it's going to control the skeletal muscles around the external sphincter. This is could be controlled and is going to be voluntary, as you can see here in the picture and as defined. So let's come to the last part of the urinary system, which is the urethra. The urethra, as you know, is going to be different in the male than the female. The first thing to distinguish between the urethra in the male from the female, that the urethra, as you can see, this is the urinary bladder here, and the urethra in the male is very long, and it has many parts that we're gonna identify anatomically. And as you can see here in the female, it's very short and direct forward. Let's start with the male urethra. As we said, the urethra is gonna start with the internal urethral meatus or internal urethral sphincter at the neck of what? Of the urinary bladder. Also look to this picture, I like it. This is the posterior view which of the urinary bladder, which is represent the base, and this is gonna the anterior view, which is represent the apex, and this is the superior view, and from the both sides it's gonna be the inferior lateral, and here it is the neck. So the neck, at the neck we're gonna have the internal urethral meatus, then till the, and as we said, at the neck of the bladder, two external urethral meatus, which is gonna be at the glans penis. Where is the glans penis? It's gonna be this part, which is gonna have the external urethral meatus. Meatus here, that's mean opening, opening. So this is the opening from the urethra, the internal opening of the urethra, and this is the external opening of the urethra. This is nothing, doesn't have anything with the sphincters. This is the opening. Okay, at this opening we're gonna have the internal urethral sphincter. Okay, but here we're not gonna have the external urethral opening. We're gonna identify where the external urethral sphincter. But this part, the inner part is going to be the internal urethral meatus, and the outer part is going to be the external urethral meatus, and which is at the part, this part called glans penis. Okay, and this is the outer opening, and this is the inner opening of the urethra. In the male is about, its length is about 18 to 20 centimeter. It's a passage of urine and semen as well, and it's gonna be getting out the urine from the urinary bladder till get it out of the body. The male urethra is gonna be composed of four parts. The first part is gonna be here, which is gonna be the upper part before it's gonna be embedded between the prostate. This part is gonna be the prostate, so this part is gonna be called the prostatic. And the area before the prostatic is going to be pre-prostatic part. And then here we have an area that it has a bulbourethral glands. Okay, this area is called membranous. And finally, the last part and the longest part is gonna be called the spongy or penile part. Let's start with the first part, which is very small, which is this part as you can see here. This is 2 centimeter that's surrounded with the internal urethral sphincter. It's going to be at the beginning of the urethra, 2 centimeter, and it has smooth involuntary movement as we described before that is going to be controlled with the parasympathetic nerve supply. Then here as you can see, this is the prostatic part and this is the prostate gland. And as you can see, the prostatic urethra is gonna receive another duct, which is called ejaculatory duct. We're gonna take this in detail when we're gonna take the reproductive system. Okay, the ejaculatory duct is gonna open in the prostatic urethra. So, pre-prostatic part, which is gonna receive the ejaculatory duct, and then we have the membranous part, which is the narrowest and the smallest one. So the first one, the pre-prostatic, is 2 centimeter, and then we have the prostatic 3 centimeters, and finally the membranous is around 1 to 2 centimeter that is surrounding with the external sphincter of the urethra that is going to be skeletal and voluntary, that is going to be supplied by the somatic nerve. So this is going to be at the glans is going to be meatus, while here is going to be sphincter. Okay, so the external sphincter, urethral sphincter, is going to be here, while the external urethral meatus is going to be at the glans. This is going to be a skeletal muscles that is going to be supplied by the somatic nerve. Finally, we're gonna come to the long part, which is the spongy or penile part, which is 15 centimeter. It's, as you can see, especially in the previous picture, the spongy part that is gonna receive also a duct. This is from the bulbourethral duct, so it's gonna be open into the spongy or the penile part. It's going to be from the bulbourethral glands. And you're going to know the function of these glands at the reproductive sex. Finally, it's just a review. As you can see, this is the pre-prostatic. It's going to have the internal sphincter. This is a prostatic that is going to receive the opening of the ejaculatory duct. This is the membranous, the membranous part, which is the narrowest and the shortest. And finally, we have the spongy or what we call it a penile part, which is going to receive an the opening or the canal from the bulbourethral glands till the penile urethra. And that's it around the male urethra. Let's take the female urethra. As you can see, the female, this is the symphysis pubis, this is the urinary bladder, this is the apex, this is the base, this is the superior surface, and from the sides inferior lateral, and this is the neck, where the urethra is gonna start, and posterior to the female urinary bladder is gonna be the uterus and the vagina. While, as we said, in the female is going to be the rectum directly. Let's talk about the urethra. The urethra in here is 4 centimeter. It's going to be a passage for urine only, nothing else like the male. It doesn't gonna have any kind of semen or anything. It's gonna be embedded into the anterior wall of the vagina, as we said and as we described. It's gonna extend it from the internal urethral meatus, which is the opening at the neck of the urinary bladder, to the external urethral meatus, which is the opening outside here and in the vestibule of the vagina. This is called the vestibule of the vagina, that is going to have the clitoris, the external urethral meatus, and also the vaginal, and that's it. Okay, let's talk about the urethra. Also here it's gonna have two sphincter, but it's easy. At the level of the neck, it's gonna be the internal urethral sphincter, and before the outside is gonna be the external urethral sphincter, which is at this part here. Okay, so that's about the female urethra. And that's it for today. Is there any question around the lecture?
No, everything is clear. Thanks, doctor.
Thank you so much. You could stop now the recording, and good luck, and see the female group on Tuesday إن شاء الله afternoon. يلا في أمان الله، وإذا عندكم أي سؤال رقمي عندكم. شكرا جزيلا.